Hi, and it's Dr. Morrissey back today with the 8 phases of EMDR. Let's start with phase 1. Phase 1 is history taking. I begin phase 1 right at the onset with the assessment. I do it concurrently with the assessment I do in my electronic health record, and I'm adding the information into the history taking for that client. History taking doesn't have a lot of time spent on it in the basic training, and it is extremely important because a lot of therapists have told me, I've known my clients for a couple years now, but when you ask specific questions, you will get different answers than what you've been told or the information that you thought was there. So it's still very important to begin that history taking with your client, whether brand new or you've had them for a while, because you are asking specific things. The other part about phase 1 that's very important is this is where you are going to start connecting neural dots, connecting the neural network. So when you are doing that, you are looking for symptoms, right? You're jotting down events that happened. You're asking what time of season things have occurred or what month things have occurred. You're getting them to rate it, which goes into the targeting sequence plan, which is another video. And you are starting to figure out or reverse engineer why these clients or this client has more depression or more anxiety in the spring or fall. And when you start to look at all the stuff in your history, their car accidents, the deaths, the divorces, the moves, all of those things happening at certain times of the year. And then the clients are left wondering, why am I more depressed in the fall? Why am I more depressed in the spring? This will help you to figure it out and to give them those answers. So phase 1 is extremely important. There is a lot to it. I will get into more details in another video. Phase 2 is the resourcing. You are preparing the client for EMDR, figuring out, do they have a brain injury? Am I staying away from eye movements? Am I going to do tactile? At what speed do I do it? Right? You are doing the resourcing, calm place, breath exercise, ego state resources, skills-based resources, light stream, anything like that that you are preparing them for. You are doing that in phase 2. Phase 3 is the assessment phase of EMDR. That should only take about 3 to 5 minutes because the rest of the time is needed for treatment. So phase 3, the assessment is different from what we are normally figuring is the assessment. And that is, we are looking at the image. What is the part of the image that stands out for them? Now, I always ask, is the image in color or black and white? Is it clear or cloudy? Is it close or far? Is it moving? Is it still? Are there smells or sounds that go with the memory? That way, right off the bat, when you start doing a couple of sets, if something pops up that is disturbing, you already know, hey, this is in color. What if we turn this to black and white? Would it be less disturbing? Wow, you feel like you're in it. What if you pushed it further away? Would that feel less disturbing? And you don't have to stop what you're doing in order to do that. You can just seamlessly transition right into that. Okay, now not everybody has an image, so don't get caught up in that. If they have a negative cognition, a body sensation, the emotion, you can do it. If they have an image but no negative cognition, EMDR can still be done. Look for the emotion, the body sensation. Okay, so as you go through the assessment, all these questions are there. And what they don't usually explain, trainers don't explain, but luckily mine did, is that Francine set this up. Basically, she's activating left brain, right brain, left brain, right brain. Each question activates a different part of the brain that is holding on to these memories. So it's important to get as much as possible, but if you can't get it all, don't let that stop you from doing EMDR. Phase 4 is the meat and potatoes of EMDR. That's where we do a lot of the work. That's where the desensitization occurs, right? That's everything is big is happening in phase 4. Okay, phase 5, we are doing the positive cognition. We're installing that after phase 4 is complete and the SUDS is 0 to 2, right? So phase 5 is installing that positive belief. What would you like to believe about yourself now? Checking in if they already gave you one, does this still fit, right? If not, adapt it. Phase 6, you're scanning the body, right? When you think of the original memories from head to toe, scan your body. Is there anything out of place, anything that is still bothersome or disturbing? If it is, you go back and do phase 4. If not, then you move on, right? Phase 7. So sometimes clients will seamlessly move into a future template while they're doing phase 4. Sometimes it comes during phase 7. Sometimes phase 7 is closing down the session with a light stream, with a calm place, with some sort of resource, right? If the session's incomplete. If it is complete, this is where you would do your future template. So phase 8, we are concluding therapy. And phase 8 can also be used. What did you notice last week or in the past 2 weeks after doing the last session? It's checking in, having them notice the changes that have occurred, what's there, because EMDR continues to work, noticing those little things, right? I always ask them during phase 1, who's your barometer? Who's going to be that person that's going to be able to check in with you and notice those subtle changes? We're all going to see the big changes, the smack me upside the head with the 2x4 stuff. We don't always see those subtle changes. And it's great to have a person there who knows them very well, who will recognize the subtle changes when the client doesn't recognize it. Okay, so that's a quick few minutes of all the phases of EMDR. I will have more videos getting into a little more detail, kind of whetting your appetite to see if you want to get trained. And hold on, because there is more to come.